Wile Lusige, good morning. And what has the county prepared, has the country rather prepared to combat coronavirus?
Good morning, Brenda. We have been doing county spot check to check how they have been prepared, the measure that they have put in place to avoid any spread of the coronavirus. And yesterday we were at the border and we also checked how they are prepared. But apart from that one, we also today decided to come here at Vihiga County because this is the county that borders Western region and the neighboring Nyanza region, and so far for them also they have put in place measures to protect those ones getting to most of the public offices and also health institution. This is Vihiga Referral Hospital, where they have their only isolation center, and what they're doing that they are also screening all the patients who are coming in, checking their temperatures and also getting their travel history before they can proceed to get treatment. So far in the entire Western region, we have not seen any case, but we have seen more energy being invested on how to prevent rather than treat, because every county has already set up what we are terming as isolation centers. So this being one of the critical counties because it neighbors two regions with a different movement pattern, then for them also they are doing much that they can be able to, so that they can protect the residents of Vihiga County from the spread of the coronavirus. And apart from that, also they have put in place measures that we have seen in other counties, including banning burials, weddings and any other kind of mass gathering. And apart from that, also they have banned night discos or any joints that are not now supposed to operate more from around 11 p.m. that is in the middle of the night. And also it's very, very important to highlight that also they're trying to give the members of public sanitizers, because if you go to most supermarkets, even here in Vihiga, there are no sanitizers. And apart from that, also they're trying to find other alternatives, including giving patients soaps so that when they can go home, they can also be able to clean their hands. And apart from that, we have seen an increase, or actually an increase in the demand of those sanitizers. But at the same time, we have seen most of the markets here closing down all the way from Kakamega to Vihiga. If you go to the town, you can feel that the number of people has really reduced, because most of them are trying to confine themselves in their homestead. And apart from that, we have seen a number of institutions also closing down, including government offices. Most of them have tried to reduce the number of workers who are playing their duties in their offices. So you can feel the impact, because you will not see many people in town, many people in streets, or many people in the market centers, because most of them have been shut down. And now members of public are being advised to do what we call, maybe call someone and go and buy things and then just return home. And also here in Vihiga, they're trying to implement an inter-county limit movement, where they are cautioning the residents of Vihiga County to try as much as possible to avoid traveling to other neighboring counties, Brenda.
Wile Lusige, and just before I let you go, there was a suspected case of a coronavirus in Kakamega County, which caused a lot of panic. Kindly bring us up to date, probably with the latest information, if you have, about the test results of the victim.
You see, what happened yesterday was an isolation case where a patient who had traveled all the way from Dubai to Kakamega, he's a renowned businessman, but we don't know who he is, because his name has been protected from the public. Yes, he was isolated at the Kakamega Isolation Center, but apart from that, also what they're doing, because he's still at the isolation center, they send tests or samples of his blood to Kemri, Nairobi, so that they can be able to find out if really this is a coronavirus case or is just another case of misdiagnosis. So we are still waiting to see if they will be able to provide the results in the course of the week, because they said they need 2 days to be able to finalize on the result. Then the results will be sent to Kakamega, and then definitely we'll be able to know better if that case was really a coronavirus issue or is just a normal ailment. And it's very, very important to emphasize to the members of the public that they should not be fearful, because this is a case that has not yet been confirmed that is coronavirus. And Brenda, is also very, very important to speak to the governor of Vihiga, because he has just come in. Briefly, you can tell us, because we have seen a challenge in terms of sanitizers. We do not have enough of them. What are you doing? Have you provided funds for that? And also, I'll keep distance from you, because I don't know if you jetted in from Italy.
No, I have been in the county and I'm here addressing this issue of the coronavirus. And what I want to say is that, yes, there's an issue of sanitizers which are in short supply, but as a government, we have put enough resources. As the statement I gave yesterday, we have set aside about 20 million shillings to deal with this pandemic of the coronavirus. So as a county, I want to say that we are ready and we are prepared and we have put the necessary facilities in all our health facilities in the county. So I want to say we are ready. Even the isolation center, which I think you may have visited, is ready. And we are monitoring even any of the people who are coming to this county from outside, particularly those who have traveled from overseas. We are monitoring to ensure that if they arrive, we be able to monitor them and see what is going on, because we are very concerned about this pandemic. And as a county, we want to work closely with the government and the rest of the world authorities to ensure that this disease is contained.
How many beds are in that isolation center?
So far, we have put 4 isolation beds, but the building we have can take as many as 20. So the building is ready. What we are now working with the national government is to ensure that we get more beds. We have requested for more equipment, more of these suits, more of this, all this equipment that is required. We are working in collaboration with the national government, but as a government ourselves, we have also put resources to do it. I think that's what I want to stress, that we have put resources. We are also put up a very elaborate program for sensitization. We are working with the county commissioner, who is my vice chair on the county emergency response committee on coronavirus. We have all the chiefs, assistant chiefs, they are out there. Our ward administrators, they are out there creating awareness. We have trained our health workers, they are out there training. Some of our health workers have already, the doctors have gone to Nairobi to be trained, to become trainers of training, to become TOT, trainers of trainers. Okay, so we are already doing that, and I want to say that as a county, we are up to it.
Yeah. Governor, I'll cut you short because of time. Brenda will be following up on the more updates on how these counties have prepared in terms of the COVID-19 outbreak.